That used great segue into my question for Joyce. It's perfect. Although I know Jennifer's over there. You have a lot of to-dos from Debbie's comments. Hope you wrote them down. I've never heard that term post-occupancy. Sir, love that. Jennifer. Okay. Interprofessional. Really important. And I was curious, Joyce, you had so many great comments I was trying to write down really quickly about the Future of Nursing report, and part of that is interprofessional. And I'm curious from your lens through HIMSS, what you're seeing in terms of, because we're at a great stage, such a great foundation here at Texas Children's. I've only been here just over a year, so there's already a great foundation that I can take zero credit for. But with the birth of our new clinical informatics department, we have a chance to leverage what's already here, but really craft it and build it in a great way. So the interprofessional piece I'm really interested in, but also what you're seeing interprofessionally and involving parents or families of adult patients into what the right technology is and how to implement it, and so that the patient benefits the most. So I was just curious if you're seeing any of that on the horizon. We try to build parents into everything we do here on our committees. Jennifer and the innovation and technology team is adding parents to that, and just curious what you're seeing on the national landscape.
Sure. Interprofessional is very much part of the forefront, and there has been some research that the IOM did and others to focus on the importance of how we can and should be working together. So I know I speak a lot from my background in nursing informatics, but I think we were some of the pioneers in moving the specialties forward, and now other clinical specialties like pharmacy and even our physician colleagues are really looking to kind of build upon what we've done, and HIMSS specifically is looking at broadening our focus. So it's more healthcare informatics and working with all of the colleagues. So HIMSS has built a nursing community of about 5,300 nurses now, and that's 10% of our membership, so that's pretty cool. But now I've been given the physician community to help to build, because we've done such a great job with nurses. Well, it's a whole different group and a whole different focus, but a very important one. So nurses and physicians need and do work together, CNIO roles, CMIO roles, to move these big, huge initiatives forward. And that's great to see. So that's definitely where we're heading. Related to patients and families, HIMSS has not had a huge focus in what we have called consumer engagement, but it is an awakening one, and boy, is that important now. And our first effort into that was really helping providers to be equipped to deal with when the physicians and nurses come and say, bring in your own device. That's one focus, but another is really taking that to the next level into the home with devices, and how to prepare patients and their families to deal with that aspect. So now we do have a consumer focus in HIMSS that is more focused on equipping patients for that. And we don't always think about the parents, but clearly that is a part of the conversation, and families in general are as well. So if you go to our website, you'll see more and more resources and tools for that, communities that gather to talk about that, what is important about that. So you're hitting on the two cutting edge areas that we're building into, and hopefully will help to equip you in your needs. But I also want to ask you to help us as well. You have been through a journey that's very important to share. And just your point about the decentralization and the challenges you're seeing, I'm glad to hear you're not afraid to talk about the pain points. And I would encourage you to go and put out proposals and posters and publish about your experience, because it is so important to others that are going down that same journey, and you have a lot to share.
I guess we're standing between you and lunch. All right, well, we will wrap up and we will move into the lunch hour. I want to thank our panelists for the discussion. All right, keep in mind our vendor partners are here. We have GE, we have Cisco, of course, Connexol. We already mentioned Rollenberg is here as well. Honeywell, a lot of our Navicare device integration system vendors are here, so make sure you get a chance to stop by. We'll be back from lunch at 1:30. Lunch is straight out the doors, and enjoy your lunch, and we'll see you back at 1:30.